The small Balkan nation of North Macedonia is reeling. A devastating fire ripped through the Pulse nightclub in Kočani. It happened on March 16, 2025. The date will forever be etched in the nation's memory. This tragedy has left a scar on the national psyche. The fire, occurring during a performance by the popular hip-hop group DNK, claimed the lives of at least 59 people. Over 150 were injured. The victims, mostly young people aged 14 to 24, were simply enjoying a night out. Their lives were cut tragically short. The Pulse nightclub, a former carpet warehouse, was packed beyond capacity. An estimated 1,500 people were inside. This was far exceeding the venue's safe limit. The disaster has exposed serious lapses in safety standards. The tragedy has sent shockwaves throughout the country. There is a collective sense of grief and disbelief. This incident serves as a chilling reminder of the importance of public safety regulations. The nation mourns the loss of young life. Families grapple with unimaginable loss. The small town of Kočani, known for its rice fields and vibrant cultural scene, is now shrouded in sorrow. The fire's intensity and speed left little time for escape. The incident has brought to light the critical need for accountability. It has also brought attention to the need for stringent safety protocols in entertainment venues. The nation demands answers. The catastrophic fire at the Pulse nightclub was no accident. It was a tragedy waiting to happen. A deadly combination of factors turned a night of revelry into a nightmare. Eyewitness accounts and video footage reveal the terrifying speed at which the fire spread. It began around 2:35 a.m. during DNK's performance. Pyrotechnics, a staple of their act, ignited the club's flammable ceiling. The club's interior, with its low ceiling and lack of proper ventilation, quickly became an inferno. The use of flammable materials in the club's construction exacerbated the situation. Thick smoke engulfed the venue, causing panic and confusion. The absence of adequate fire exits and insufficient fire extinguishers compounded the tragedy. The club's owner, who reportedly bypassed safety regulations, is now facing arrest. The incident has exposed a blatant disregard for safety regulations. This disregard is a problem plaguing many entertainment venues in the country. The tragedy has sparked outrage and calls for justice. The investigation will delve into the club's licensing and safety inspections. It will also investigate the use of pyrotechnics without proper permits. This incident serves as a grim reminder of the importance of safety regulations. These regulations are essential to safeguarding human life. Panic erupted as the fire quickly spread through the Pulse nightclub. Terrified screams filled the air as concert-goers realized the gravity of the situation. The club, packed beyond capacity, quickly became a death trap. People scrambled for the exits, only to find them blocked or inadequate for the surging crowd. Eyewitness accounts paint a harrowing picture of chaos and desperation. Many were trampled in the rush to escape the inferno. The thick smoke made it difficult to breathe or see, adding to the terror and confusion. Some survivors recount acts of bravery, with individuals helping others escape. Others recall the agonizing screams of those trapped inside. The scene outside the club was one of utter devastation. Emergency responders arrived to find a chaotic mass of injured and traumatized individuals. The emergency response to the Pulse nightclub fire was swift, but ultimately overwhelmed by the scale of the disaster. Ambulances rushed to the scene, their sirens wailing through the early morning darkness. Paramedics and first responders worked tirelessly, tending to the injured and transporting them to hospitals. Hospitals across the country, including the main facility in the capital Skopje, were pushed to their limits. The injured, suffering from burns, smoke inhalation, and trauma, flooded emergency rooms. Medical staff worked around the clock, battling exhaustion and dwindling supplies. The severity of the burns, in many cases, required specialized treatment. Patients were transferred to hospitals in neighboring countries like Bulgaria, Serbia, and Greece. The tragedy exposed the limitations of the country's healthcare system. The incident highlighted the need for increased capacity and resources. the government mobilized all available resources to manage the crisis. This mobilization included dispatching additional medical personnel and supplies to overwhelmed hospitals. Despite their best efforts, the death toll continued to rise in the hours and days following the fire. The tragedy left an indelible mark on the nation's healthcare workers. It also left a lasting impact on the families who lost loved ones.